Welcome to the Oklahoma City Veterans Affairs Medical Center. Here in the outpatient pharmacy, our primary goal is to help veterans return to or maintain health by providing prescription medications after scheduled appointments, hospital visits, urgent care visits, or walk-in care. Each year, our pharmacists process approximately 1.7 million prescriptions for veterans in our system. About 10 to 15% of these prescriptions are prepared and dispensed by the outpatient pharmacy staff right here at the main facility. The remainder are sent to our CMOP facility and mailed to the patient. How do staff prepare and dispense all these medications? The answer is a combination of hard work and automation. The outpatient pharmacy integrates key automation equipment to help fill all those prescriptions each year. This automation helps with accuracy, speed, and drug accountability. We hope that by showing you the entire process, you will better understand the time it takes to get your prescriptions right. The prescription process starts with your provider. When the provider enters a prescription into the computer, they fill out all the relevant information about the medication. They add provider comments, such as the indication, and designate if the prescription should be mailed or picked up at the window. The pharmacy receives prescriptions from providers all over the state, including our CBOCs and our Care in the Community partners. All of these orders are staged in one big computer waiting line and waiting for a pharmacist to review. That's about 2,000 to 2,500 new prescriptions per day. Given the high volume of prescriptions received every day, all patients are encouraged to visit with a pharmacist when possible. The pharmacist will counsel on how the medication works, when is the best time to take the medication. This discussion with the pharmacist will also ensure that needed prescriptions are made ready for the window. Mailed prescriptions will come when due, and they can even place as-needed medications on hold until they're wanted by the patient. However, pharmacists do more than just count tablets. The critical role of the pharmacist is to verify medication safety. What does that mean? It's a multi-step process with many safety checks. Pharmacists review the patient's medication list for duplicate prescriptions, identify drug allergies, or determine if any drug interactions could result by taking the new medications with those already prescribed by your doctor. If any issues are found, the pharmacist contacts the provider, and they work out the best treatment plan going forward. The pharmacist then ensures all changes are updated on the prescription label and counsels the patient as to what to expect from their medications. Once the order checks are done, the prescription is sent down the line for a technician to fill. Once the technician receives the prescription from the pharmacist, they use automation to increase efficiency and reduce errors in the filling process. Our primary outpatient automation equipment fills high-demand tablet or capsule prescriptions. This equipment does everything from counting to affixing the label and placing the cap on the vial. All of this is barcode-driven to ensure the right patient gets the right medication. We employ specialty technicians to run, monitor, and maintain this equipment. These technicians work every day and ensure the automation interfaces with the computer system to fill prescriptions quickly. Concurrently, filling technicians manually prepare refrigerated medications, creams, inhalers, and supply items. These manual fills by technicians also use automation by scanning and barcode technology to ensure each hand fill is verified by the computer. After the technician prepares all the patient's prescription, the pharmacist rechecks everything. This is called the pharmacist's second check. This final verification also uses scanning automation, barcode-driven technology to ensure all the medications are given to the right patient. At that time, the computer system will indicate on the display board that medications are ready for pickup. When a patient presents to the window, our window technician ensures they have the correct patient by verifying two different forms of identification. Therefore, it is always best to have your VA ID with you to facilitate this process. Once the patient is identified in the computer system, our technicians will perform one final scan of each medication to ensure all the medications in the bag belong to just one patient. Finally, the medications are considered safe and effective and ready to be handed out at the window. We do note that it takes time to prepare your prescriptions correctly. This video was to show you the process on the inside of the pharmacy and all the effort that is made on your behalf. We also appreciate your patience while we get your medications ready. Feel free to ask any questions to our pharmacists or technicians at the counseling booth or window. It has been our pleasure to serve you today. and we appreciate the opportunity to work together to help you maintain a return to health. We appreciate your service and thank you for all that you have done for our country.